How's everyone doing? Everybody's good?
Yeah.
Hi.
Good.
I'm gonna send you a text about what time I can work.
Fabulous.
You're welcome. Bye.
Can I get everybody to put their mute on just so that we don't hear any external voices? If you do have a question, send me a chat. For those of you who are not familiar with Zoom, there is a chat button on the bottom of your screen, and that should move things forward or shut things, or you can message me and I'll get that message and I can see what we need to respond to. So, I'm hearing some nice background music. Very nice. Okay, so let's get started. Good afternoon, everyone. My name is Dr. Nusheen Darvish, and for those of you who don't know me, we are at Holy Speak here in Bellevue. I'm the medical director and founder of Holy Speak, Naturopathic Medical Center and IV Pouch. And we are talking about hormones and well-being, aging, and all of that good stuff today. So I really want this to be an interactive setup. So please do send me chat.
Just in case I need your help.
Yeah, I'm gonna have everybody put their voices on mute there. Let me see. Okay, so just as a disclaimer, this is a presentation that's for information only.
Am I mute?
Shainja, can you put your mute on, please? So this is for information only, and it's not intended to make any claims on any treatments or cures or provide any medical advice. So please do seek your medical provider for any of that. So first of all, what are hormones? Hormones are really signaling messengers, and they're involved with all sorts of systems throughout our body. They are involved with metabolism, your mood, our aging process, our body temperature, nervous system, blood sugar regulation, stress management, and everything in between. So it is a really important system to look at. Okay, so these are all the glands throughout our system, and each of these glands secrete hormones. So you can see how complicated this system is just at this basic level. Each of these glands produce at least 2 to 8 hormones. And so, and all of those have to be in synchronicity with each other, harmonized with each other. It's a very, very complex system. We have identified over 120 different hormones, but we know that there is more hormones that are involved in our health and well-being. So there's only a few that we're going to talk about today. We'll talk about more in the future webinars, but today we're going to focus on only a couple of these. So why balance hormones? The reason we want to balance hormones is, number one, most of us are interested in slowing down the aging process. And so we want to make sure that our mitochondria, which is our cell engine, is healthy, that our system can repair itself, regenerate itself, and also maintain what's called the telomere length, which I'll talk about in just a few minutes. But that is all about slowing down the aging process. And we also want to maintain our physical health and, most importantly, our function. We don't want to be having joint pain and memory issues and heart disease issues, blood pressure, keep our muscle strength there. And most of all, of course, this is really important for men and women, is to keep our youthful appearance, right? So there is so much that hormones do that we want to maintain in order to maintain our physical health, but also our mental health, our cognition, the way how fast and quickly we're able to think, retrieve words, memory, our emotional well-being, depression, anxiety, mood. These are all related to keeping our hormones balanced. And of course, sexual health and just the sense of well-being. So that sense of well-being is very much connected to how the hormones are functioning and how balanced they are. So this is the telomere. If you look right here, where the chromosome here is, this is part of our DNA. And the chromosome is, has a little cap. Those little markings at the top are a cap. I am getting a message that not everybody's got their mute on, so please turn your mute on so it's not distracting for everybody. Thank you so much. If you don't know where the mute button is, if you go to the left lower part of your screen, you'll see the microphone sign, and you can press on that and it'll mute you. So the chromosome has these little caps, and those caps are called telomeres. The longer the telomere is, the slower the aging process. So we tend to lose telomere length as we get older, and as we get older, the telomere goes down and the aging process becomes faster and faster, and it causes a lot of issues with heart and kidneys and brain and all sorts of things. So one of the interesting things about hormones is that the research now is showing that balanced hormones actually slow down the aging process. And this can be testosterone, progesterone, estrogen, some of the more common hormones that we are familiar about. When those are imbalanced and available to us as we get older, for both men and women, the telomere length is maintained, and thus the aging process is slowed down. One of the glands that we want to focus on is the anterior pituitary gland. That's the pituitary gland is a pea-sized gland, as you can see here, and right here. Okay, and you can see it sits right behind the eye and right behind the nose in the brain. It is surrounded by bone, and there's only microscopic space between the bone and the pituitary gland. And so what often can happen is if there is injury to the head, like a concussion or a car accident, then the bones can impact and squeeze this pituitary gland. And when that happens, then you're going to get a dysregulation in the way the hormones are released. And the pituitary gland is a very, very important part of the pituitary cyst between the, sorry, I'm trying to see if I can mute these guys because they're not muting. Hold on a second. Let me see if I can mute some of these people. I'm sorry about this. So we're gonna mute a few of these guys just because it is getting distracting for everybody. I think I got everybody. Okay, is that good? Okay, so the pituitary gland, the reason it's called the anterior pituitary gland is because there is also a posterior one. There is one that sits behind this particular gland. In other words, the front part of it is called the anterior pituitary. It's the front lobe, and it is responsible for secreting a lot of these signaling hormones that affect our thyroid, our adrenal glands, our hormones from the ovaries and the testes, even the growth hormone from the liver, and the prolactin level that is released from the anterior hormone, anterior pituitary, releases the milk, breast milk. So one of the major hormones that we will also focus in on is the growth hormone that is released by the pituitary, and then it affects the liver and the muscles and multiple other areas in the body to produce its what's called IGF-1, insulin growth factors. And these factors are involved with multiple systems in our body to allow the growth of our cells and regeneration of our cells. The back part of the pituitary doesn't release hormones, but it stores hormones. So from the hypothalamus, which is the part of the brain that is a little bit above the pituitary, signals are, the hormones that are released are these two, the oxytocin and the vasopressin, which are stored in the pituitary gland, the posterior one, and then the posterior one releases it when there is a need for balancing the water levels in our system, and oxytocin, which is that hugging hormone, that hormone that's released right after birth, for instance, and you just want to bond with that baby, that's the oxytocin. But oxytocin is released many other times throughout the day. Even by just giving a hug to somebody, you actually increase the oxytocin in your system. So this is a growth hormone axis, and you can see it affects multiple areas in our body, including the liver, the cellular regeneration, the fat breakdown, the metabolism of the fats, your muscle strength and muscle growth, as well as blood sugar regulation. And it has a feedback system that goes all the way back up to the pituitary gland and telling it to shut down or stimulate if there is not enough in there in our body. So few things cause a growth hormone dysfunction. This, like we mentioned earlier, injury is a big one that most often is overlooked. So even if you have a concussion in your teenage years or a car accident or sometimes even a fall, banging your head somewhere, that can disrupt the growth hormone release. It can disrupt the other hormones. Not getting proper nutrition, especially protein, the aging process, high stress, and of course other kind of chronic diseases can reduce the growth hormone function. So this is something that we need to always keep in mind. Some of the hormone deficiency, growth hormone deficiency symptoms that can happen, I'm sure many of us can relate with at least a couple of these, is very, very common as we get older. So fatigue, of course, is a very common one. Even the loss of muscle mass or bone density. How many of us have osteopenia or osteoporosis? That can be impacted by the growth hormone deficiency. Cholesterol levels, especially LDN, which is your bad cholesterol, if it's increased, can be a signal of growth hormone deficiency. And then we've got atherosclerosis, plaque buildup in the arteries can be also a sign of growth hormone deficiencies. Not to mention depression and anxiety, which is really common right now in our society because of the situation that we're all in. And it can also cause just a sense of lack of well-being. So something to keep in mind as we are looking at all the hormones is to look at the growth hormone and evaluate. Can we get you guys muted? I thought I muted everybody, but there's still somebody who's not unmuted. Please make sure you mute yourself. The hypothalamus, pituitary, and adrenal axis is a really common axis that we often look at. This is something that we look at in patients, especially when they have gone through a lot of chronic stress or acute stress. It can cause dysfunction in this axis. And as you can see, there is a loop, basically a feedback loop that happens from the hormones that are released from the adrenal glands, such as the cortisol, which is one of your stress hormones, and it goes back to shutting down the hypothalamus and the anterior pituitary. So when you have a lot of stress, you have a lot of cortisol running around, and hence it affects the signaling from the pituitary, this master gland, to all the other glands. So not just the adrenals, but to the thyroid, to the ovaries, and to your pancreas, to multiple different systems in our body. And this is one of the biggest reasons why hormones go wacko when we're under acute stress or chronic stress. So it is another reason why we need to maintain our stress and manage our stress in order to keep these hormones so balanced. Remember, pregnancy is a stress. Loss of a job, loss of a loved one, change of work. I mean, it can be a stress from an external environment, but also there can be internal and environmental stress, such as skipping meals or eating a lot of sugar, exercising too much or not at all. Those are all different forms of stress that can impact our hormone and our hormone regulation, and thus our general well-being and aging process. This is another kind of a loop and cycle that is often involved in our body, the hypothalamus, pituitary, thyroid signals. But keep in mind that this area here, the tissues, your cells, is where the active form of thyroid is formed. That's the T3. So most of the inactive thyroid, the T4, is produced by the thyroid gland, a little bit T3, which is the active form, but then mostly it's inactive, T4. And then T4 goes into our blood, into our cells, and that's where it's changed from T4 to T3, where we tend to have more of the active T3. So when you have thyroid symptoms, low thyroid symptoms, it's not always because the thyroid's not producing. It could be because your tissue is not changing the T4 into T3. And that can be a very, very common problem after chronic illness, after chronic stress, after pregnancies, during menopause, andropause. This change between T4 and T3 is not happening, and you have symptoms of thyroid, but you actually don't need more thyroid. You need the correction of the conversion from T4 to T3 to be evaluated and treated. Now, thyroid is very, very difficult to address or diagnose because oftentimes it doesn't show up on blood work. And as naturopathic physicians, we have other little tricks that we use to evaluate the thyroid more completely. And oftentimes, even if your thyroid levels show up well and proper on your blood work, and you still have the symptoms, we will still diagnose you perhaps with what's called subclinical hypothyroidism or iodine deficiency thyroidism. So these are some of the things we just mentioned, but just make a note that iodine, selenium, vitamin B6, zinc, and tyrosine are very, very important for the thyroid hormone production, but most of these nutrients are also very important for the shift from T4 to T3. So a lot of times we may just end up giving you vitamin B6 and zinc and selenium and say, okay, well, you're done with the thyroid balancing and your thyroid seems to be working well now. And that may be all you may need. Other times we need to look at what's actually causing a thyroid deficiency or an iodine deficiency. For instance, looking at toxicity, especially chemical toxicity levels, bromide and chlorine toxicity, which is very common with people who use a lot of hot tubs. So it is very important to look at the minerals and the vitamins in your system for thyroid function and not just keep giving you thyroid hormone. I've got a few chats here. Let me see if I can answer some of these. Nope, I think nothing new that I've answered so far. Okay, so some of the symptoms that we are very familiar with low thyroid function are, weight gain and constipation, bowel changes, hair loss, cold hands and feet, not being able to tolerate stress. So if you're finding that you're reacting to stress more than the average person, or it's a change for you, then we may be looking at not only thyroid, but also adrenal hormones. And that's something else to recognize, is that a lot of the thyroid hormones symptoms can also be adrenal hormone symptoms. And oftentimes the two of them do play a dance, which means that when thyroid's not functioning, adrenal hormone, your stress hormones will try to adapt or compensate for the malfunction of the thyroid, and vice versa. If your stress hormones are really out of balance, then the thyroid may try to compensate. So in that case, it's not necessarily giving you more thyroid medicine, it's correcting the adrenals, and the thyroid will correct on its own. And we can also have hyperthyroidism. This is less common, but does occur, especially after pregnancy, and it's often more common in men than it is women. And it is a symptom of too much thyroid, where the metabolism is too much, you lose weight, you're burning fat too much, you can't keep your muscle, you're anxious, you can't sleep, you're sweating a lot, your heart's beating. All of these kind of symptoms can be a sign of thyroid being too much. Now I want to focus in a little bit on estrogen. Estrogen is something that's common both in men and women, and there's 3 forms of estrogen: E1, E2, and E3. I call them the good, the bad, and the ugly. And the good guy, the E3, is the hormone that is cancer protective. It protects your tissues from inflammation. It is a good one that you want around in order to suppress some of the toxicity from the other estrogen-related conditions. E1 is the bad guy. That one's the cancer-causing one, the inflammatory one. It is also the one that is produced by our fat cells after menopause or after andropause. Okay, andropause is when men go through their testosterone cessation. And so E1 is produced mainly by our fats, and hence cancer risks increase after menopause and andropause because we tend to have more fat, and our fat produces more of this toxic estrogen. And therefore it becomes really important for us to keep a good balance between the fat and the muscle ratio in our body. E2, I call it the mediocre or the bad guy sometimes, because it can become E1, so it can become the ugly estrogen, but it can also become the good estrogen, depending on multiple factors, including our genetics and our diet and lifestyle factors. So in Western medicine, E2 is the one that is often prescribed when there's estrogen deficiency. But the problem with that is that we don't know how your body's going to transform it. Is it going to transform it into a good guy or the bad guy? Is it going to become more cancer-causing or more protective? And so we tend to do a more of a complete evaluation of these hormones to see what the balance of all of these estrogens are and how we can intervene to improve the estrogen, but the good form of estrogen, and keep everything in balance. Okay, so estrogen is very important, of course, for female development, but also for brain health in both sexes, for mood stabilization, for cholesterol metabolism. And that's one of the reasons why females have lower cholesterol before menopause as versus after menopause. And it's because estrogen goes, the bad estrogen goes up and the good estrogen goes down, and cholesterol metabolism is reduced. And so our liver produces more of the toxic estrogens versus, or the toxic cholesterol versus the better quality cholesterol. Men, unfortunately, have less estrogen in their system, and hence throughout their whole lifetime, they have higher cholesterol. So estrogen metabolism plays a big role in heart disease and prevention, and your weight and blood sugar sensitivity, your insulin levels, diabetes, and all of that. And these are some of the things that cause low estrogen. And one of the things I want to point out is, again, malnutrition. So if you're not getting enough nutrition, if you're not getting enough of your B vitamins, your amino acids, and you're going to not have enough nutrients, and your fats. Fats are really important, healthy fats. You're not going to have enough basic building blocks to build your estrogen levels. Now, progesterone is the other hormone that we regard as a female hormone, but it is also incredibly important for men. Progesterone is important for bone health in both sexes. Both heart disease, immune system, mood, and nervous system are impacted by our progesterone levels. And progesterone is one of those things that starts dropping as we go through andropause and menopause. It is one that is very calming. It helps us with sleep and anxiety. And this is one of the reasons women tend to have more PMS before menstruation. They get more moody, is because oftentimes the progesterone level is too low and the estrogen level is too high. And so we get more anxious, or we have more sleep issues, and these symptoms can worsen as we get closer to menopause. But then we also see these symptoms also increase with men around andropause and as they get older, because their progesterone level is dropping. Progesterone is vital to the production of testosterone. You cannot have progesterone, you cannot have testosterone without progesterone, and you cannot have sperm production in men without progesterone. So this hormone is very, very important, and it's often overlooked in men just as much as it is overlooked in women. Progesterone in both genders is important for bone health again. So when there is low progesterone, we see more osteoporosis, osteopenia, we see more hot flashes. So this concept that hot flashes are caused by estrogen is not true. Estrogen can cause hot flashes, or low estrogen can cause hot flashes, but more often it's actually low progesterone that causes the hot flashes around menopause and andropause in men as well as women. And then we got fertility and bone issues, bloating issues, weight gain, and one of the more important ones is insulin resistance and diabetes. So insulin resistance, something we should spend a whole hour talking about, because it is something that is becoming more and more common in our society, and it is the precursor to diabetes. But it is increased when there is low progesterone. It's also increased when there's too much progesterone. So then, we see this balance that needs to happen. We can't have too much of these hormones because they can cause some of these things, and we can't have too little of it. That's where the art comes in, and that's where it's important to see somebody, a physician, a provider that addresses both all the hormones and not just focuses in on one or two, especially when it comes to men. I see men going and getting testosterone levels and getting on testosterone, but really they need to have their building blocks rechecked. So estrogen excess, the reason we talk about estrogen excess is because it is very inflammatory. And our fat cells, like I said earlier, create these toxic estrogens. And they can lead to diabetes, and they can lead to bacterial imbalance in our gut. They can lead to chronic stress and toxicity. But also all of these kind of lifestyle habits and conditions can cause increase in estrogen. So birth control pills increase the estrogen in our system, blood sugar dysregulation, a high fat diet, a high sugar diet, a low fiber diet, those can increase the estrogen. And by the way, this is one of the issues with the keto and the paleo diets that are so much of a fad right now, is that there is not enough fiber in these diets. And over time, these diets will cause an increase of estrogen, which increases inflammation, but they also increase insulin resistance and the risk for diabetes and heart disease. So any of these diets where there is low fiber is not a good diet to be on long term. Short term, 3 weeks, 2 weeks, 4 weeks, it's okay, but we need to make sure that we are taking good amounts of fiber in to keep our hormones balanced. Toxicity from plastics, there's something called xenoestrogens that come from plastics, chemicals in our food, like glyphosate. These all can increase the toxicity in our system and make our system feel like it's got too much estrogen versus progesterone, and that's what's called estrogen dominance. Okay, somebody still doesn't have their mute on, and I can't figure it out. So if you guys can double check to make sure you have your mute on, I would really appreciate it.
It's Kim Clark.
Thank you. Okay, so testosterone, like we mentioned, is very, very important. We're going to spend some time talking about testosterone, both in men and women, and later webinars, but I just wanted to bring this up, that testosterone is just as important for women as it is in men. It gives both men and women a sense of wellness and well-being. It helps us make decisions. If you find yourself being very indecisive, it's typically a low testosterone issue, and this includes men as they get older. As women get older, the testosterone goes up. And so you might notice that women become a little bit more bossy as men become less bossy, and it is because of the testosterone shifts that happen in our system. So testosterone and many of these hormones play a role in our behaviors and our communication and our relationships and the way we relate to our partners and our kids. And so it's another big reason why we need to address these hormones and keep them in balance. So here is some of the symptoms of low testosterone. There's a question about how do we balance these hormones, and I will address that in just a few minutes, because that's what I know most of you guys are looking for, but it is something that I thought is very important for us to understand what these hormones do and how they manifest themselves. So these are some of the symptoms that happen both in men and women, except for the erectile dysfunction is mainly in men, but this can happen in both men and women. Okay, why come to a functional doctor or an anti-aging doctor like us versus an endocrinologist when it comes to hormones? It's because endocrinologists tend to look at disease of those glands. So those list of glands that I just showed you at the very beginning, the pituitary gland, the hypothalamus gland, the thyroid, the pancreas, and so forth, those are glands that can create, tumors and become diseased. And that's when we send you to an endocrinologist. But most of the time, 95% of our lifetime is spent in the anti-aging or the aging or the functional mode or imbalance of these hormones. And that's something that we specialize in, we focus in, is how do we create balance within these hormones? How do we optimize your hormone balance in order to optimize your function, whether it is your mental, physical, emotional, or just general well-being? And then this takes a little bit more evaluation. So we're not just doing blood work. And when we are doing blood work, we're doing a much more comprehensive level of blood work. We're looking at hormone tests that are in the blood, but also in the urine. Something we do is called the Dutch hormone urine test. And that basically involves taking 12 hours or 15 hours of evaluation into account of all what these hormones are doing. And then the saliva test used to be a more common test that we did that looked at mostly the adrenal hormones and some of the female hormones, but most of that has now been incorporated into the Dutch test. And I'll give you a little sample of what the Dutch test looks at in just a minute. We also look at the microbiome in the gut, and we'll focus in just a minute on the microbiome. But that microbiome, the gut bacteria, is very, very important in the way the hormones are balanced. And then it's, again, often overlooked. The way the hormones are balanced through the microbiome and the impact the microbiome has on the hormones, and the way the hormones impact the microbiome. It's always about this bidirectional system. What came first, the egg or the chicken, you know? And so it's like we need to look at it all and break that cycle of whatever may be going on. We also look at something called your autonomic nervous system and heart rate variability. And this is also very important because it gives us an insight of what the nervous system is doing to impact these hormones and how these hormones are impacting the nervous system. These are some of the tests that we typically run to evaluate some of the hormone functions in blood. Okay, so it's much more comprehensive than what you would find with conventional doctors. This is looking at the array of all the hormones that are looked at, plus more on the Dutch test. Also it looks at the B vitamin levels and the glutathione levels, your neurotransmitters, which are the chemicals and the hormones involved for mood and so forth. So that's what we look at when we're looking at Dutch. The Dutch test also tells us what the balances are doing between these hormones and between these systems. So the key to really balancing hormones is to make sure that the body is doing the job, the hormones are doing the job, and then they're leaving, they're detoxing, they're getting out of the system. When they do their job and these hormones hang around in our system, that's when toxicity increases, that's when we have more health issues. So one of the things that we are always looking at is the way the estrogen is metabolized. And if you look carefully, one of the big issues or one of the big systems we look at is this liver. This liver is really at the central station of the processing of all of these hormones and chemicals. When the liver is bogged down, whether it is from alcohol use, chemicals, cleaning products, toxins in our foods, glyphosates, whatever it may be, stress, this liver gets bogged down and its capacity to detoxify some of these estrogens and hormones in our body is reduced. And so hence, we get more of these toxins hanging around that have to be cleared either by the kidneys, or they end up going and recirculating into the system, and that causes even more toxicity, more inflammation in the body. We can also see that the microbiome, this guy here, so there is a whole system of bacteria in our gut that functions to metabolize estrogen, and those are called estrobolomes. And again, this bacteria balance has to be at the right level with the right bacteria in order for us to process and eliminate some of this toxicity from these hormones. Otherwise, the hormones get back into being reabsorbed to the colon wall, back into stressing the liver, and back into the bloodstream. So this is why a lot of times when you come to naturopathic physicians, we may say, or you may say that you've got hot flashes and sleep issues, anxiety, but we're saying, hey, we got to clean out your liver, okay? Because the liver is really the center of a lot of these hormone balances, as is the microbiome. Insulin is one of those other hormones that is often missed with regular blood work that I really like to look at, because insulin affects the way your estrogen, your testosterone, your progesterone, your growth hormone, and your stress hormones are produced and in balance with each other. If you've got too high of an estrogen, it will reduce your testosterone levels. If you've got too high of estrogen, it can increase your insulin levels. So again, insulin that is involved with blood sugar regulation is very, very important with keeping all of these other hormones in balance. In fact, it is one of the very, very first ones that we look at to balance before we even address testosterone, estrogen, progesterone, and all of the other ones. Because if we can get the insulin balance, if we can get your blood sugar balance, then a lot of times those other hormones can fall back into normal regulation and balance within each other. Like I was saying earlier, the liver is really important, but there is this other triad. It's called the portal triad that we look at, the pancreas, the liver, and the gallbladder, and how they're all functioning. And so alcohol, again, a high-fat diet, high-sugar diet, animal-based diet, stress, all of these things that we've already mentioned will impact that system and hence impact the way your body is balancing and processing hormones. So I brought this slide up again because this time I want to focus in on the microbiome a little bit. So microbiome in the gut, we talked about it last week, and we'll probably talk about it again. As you can see, it's a very, very important system in our body. The balance of the microbiome, the balance of the bacteria in our gut is very, very important in the production and the processing of these hormones. Melatonin, for instance, is produced by these microbiome. If you don't have enough of good microbiome, you're gonna have lower amounts of sleep hormones. The estrogen metabolism, your thyroid hormones, which is often overlooked. How many of you have been given thyroid hormone without the gut or the other systems looked at? So everything works in synchronicity in our system. Everything impacts the other. And so we have to look at the whole system. Glyphosate, I just wanted to bring this up as something that is often overlooked. Eating organic food is very, very important because of the amount of glyphosate that is in our food and in our grains and vegetables and everything, even what's fed to our cows. And there is direct relationship of the amount of glyphosate in our diet and the amount of disruption of the hormones within our cells. So they're finding more and more evidence that glyphosate is what we call an endocrine disruptor. It means it disrupts the whole hormonal system. Okay, so if you're eating foods that have pesticides or herbicides in it, one thing that it's doing besides causing toxicity to your liver is that it's damaging the microbiome in your gut. Think about these herbicides are actually being an antibiotic. That is one of the reasons that fungus or bacteria don't grow on foods that are not organic. It's because the herbicides are technically an antibiotic. So every time you're eating food that has herbicides on it, you're actually killing off the good bacteria in your gut because it's an antibiotic. Every time you're drinking water that is chlorinated, you are drinking water, you are drinking an antibacterial, antibiotic that is going to damage your microbiome. It's killing off the good bacteria in your gut. So these are simple things that we can incorporate in our lifestyle to help reduce the aging process in our body, to help reduce the disruption of our hormones, is start eating organic and filter your water. And stop using herbicides and pesticides and chemicals on your lawns, in your planters, all of that, okay? This is one of the most important things you can do for yourself. And these are some of the things that we can do on a regular basis, on a daily basis, to support that microbiome, to support that liver detoxification, and to support our hormone function. And this is, just basically getting enough sleep, getting to bed on time, drinking the filtered water, meditation to help our stress. Did you know that 15 minutes of laughter is equivalent to 15 minutes of exercise physiologically? What that means is that the increased oxygenation to your cells, the cardiovascular benefits that you get from exercise, even the increase in muscle growth and the stimulation of the lymphatic flow in your system, excuse me, and the release or expulsion of carbon dioxide can be done by 15 minutes of laughter. So we gotta laugh, guys. Put on a funny show, read a funny book, do something. Bring a joke to somebody who you know is depressed. Bring joy to your lives. This impacts our health and well-being, our hormones dramatically. And of course, exercise, but not too much, okay? There has got to be a balance, and everybody's an individual. And this is one of the things that we work with to make sure that we are balancing our system. There's a question about a water filter system. The one that I use is APEC water filter system. We have that in the clinic here in our home. And I believe the website is free drinking water, I think, something like that, .com. It's a reverse osmosis system. I like reverse osmosis water. I think it's one of the most pure waters that's available, but you have to be cognizant to make sure that you're putting back minerals, or you're increasing minerals through eating more salt, like Himalayan salt and trace mineral salts in your diet. Breathing is another very, very important way of getting rid of the toxicity, the acidity in your system, and helping the hormones balance. There's a question about, well, what about alkaline water? I will be honest with you, I'm not a fan of alkaline water. And the reason I'm not a fan of alkaline water is because when you drink alkaline water, you are alkalizing your stomach. Your stomach is acidic for a purpose, for several reasons. One reason is protection against other bacteria, fungi, parasites, molds, everything else. If you don't have an acidic stomach, you're going to introduce a lot of these bugs into your system more readily because there's no defense. Secondly, when you're alkalizing your stomach, you are not allowing the pancreatic enzymes to be stimulated to break down the carbohydrates and the fats that you're eating. You're also not breaking down the proteins properly, and hence over time you become malnourished, and it will lead to much more stress on your intestines and your lower gut. So filtered, if you're doing alkaline water, it shouldn't be more than 7.5 pH. Anything higher is not very good for your health. And that's one of the reasons I like reverse osmosis water. It's a very, very clean water. By the way, talking about water, did you know that our tap water is not only chlorinated, but it has glyphosate in it, it has birth control pills in it, it has antidepressants like Prozac and Zoloft in it. So every time you're drinking tap water, you're getting medication into your system. And you know, one of the questions I've always had is it causing a lot of confusion in our society about hormones and hormone-related issues that are going on? And I believe if the answer to that question is a yes. So, I'm almost done, guys. Almost done. Okay, detox and liver support. We've talked about a lot of this. Just to put out a couple of other pointers. B vitamin 6, the active form of it is known as P5P. Vitamin B12, glutathione, and vitamin C and magnesium are very, very important nutrients for liver health and detoxification of these hormones. There are some other foods that you can incorporate in your diet, like artichokes and beets, lemons and carrots, that will help the liver detoxify, hence help your hormones stay balanced. And then herbs like dandelion root, drinking that as a tea is a great liver detoxifier. Milk thistle and ashwagandha, those are great herbs or nutrients to have in our arsenal, in our foods to help with the liver protection and detoxification. Castor oil packs are a great way to help the liver detoxify and keep the hormones balanced, especially if you're high in estrogens. Castor oil packs, there is a handout on our website if you want to go look at that. We do have them here at the office with all the instructions, and you can use it 2 or 3 times a week for 20 minutes, and it is really very, very beneficial for detoxing the liver. Obviously, insulin, and we talked about earlier briefly, is very, very important. We'll talk about this a little bit more, but some of the minerals that are involved with insulin balance are, again, magnesium, B6, and then chromium, vitamin E, vitamin B3, and vanadium. Exercise is one of the best ways to maintain insulin. And even if it means walking for 10 minutes after the meals to burn up that sugar, it helps your insulin balance, which ultimately helps other hormones balance. And then we talked more about microbiome last time, and here's just a little bit of a summary of all the things, or some of the things we can do to support the microbiome from a dietary and lifestyle perspective. And then if none of those things work, then these are the things that we do here, plus more, to address the hormones, pointing out ozone therapy, IV vitamin therapy, acupuncture, manipulating the spine, injection therapies are very, very important. And then being very, very precise with herbal medicine to support the specific hormones that may be out of balance, or to help stimulate their production. So the idea we always have is, how do we get the hormones to produce and detoxify? If your body is not making enough testosterone, how do we get your body to make it? If it's not making enough estrogen, how do we make it? But at the same time, how do we detoxify it? If all that fails, then we go to some of these other therapies. One's called Peptide Therapy, which again, we'll spend another webinar on this. This is a very powerful therapy that has come to US in the last 3 years, and it's starting to be regulated a little bit more by the FDA. So some of the peptides are getting harder to get, but these peptides are what's called signaling molecules. So insulin is actually a peptide, and it was the first one discovered. But many of the hormones that are signaling other hormones are actually peptides. So we can use peptides, which are chains of amino acid, to stimulate fat burning and your muscle mass to grow, to improve your sleep, to help with joint pain, hair loss, immunity, mental focus, all sorts of different things. And there was a chat about aromatherapy. Yes, essential oils do play a big role, and we do incorporate essential oils and gem therapies and a bunch of other things that I haven't mentioned. The list does go on. So if all of that fails, is then when we start using bioidentical hormones, which are really hormones that are identical to our own hormones. Synthetic hormones are what's often prescribed by conventional providers, and naturopathic physicians, anti-aging doctors, we tend to prescribe more bioidentical hormones, which are often made from plant-based. So if from soy or yams or something like that, that help stimulate and also replace the hormones if your body's not making them. So this is a much safer way to go, in my opinion, because the studies are starting to show that bioidentical hormones act very similarly to our hormones. So if you think about a teenager who is raging with high hormones, they have very low risk of cancers. And if we have our hormones balanced, there's no reason that it should increase the risk of cancers. When the cancer risk is increased is when the hormones are out of balance. So if you are using bioidentical hormones and one hormone is higher than the other, or one of them is lower than the other, then that can increase your risk. So it's all about balance. If you're using synthetic hormones, the risk for heart disease and cancer and inflammation has been shown to go up. And that's one of the big reasons we don't use the synthetic hormones. And the processing of a lot of these hormones can be impacted, again, by the health of your liver. So the question is, once we start these hormones, do we have to take them forever? The answer is no, not necessarily, because if we're monitoring them, and as your body stores them in fat and liver and other areas in your body, you may not need as much as you get older. So it's all about graceful aging, not anti-aging, right? We don't want to stop the aging process, because at some point we're all going to, get to a place where we all need to transform into the next realm, into the next world. But while we're in this world, we want to be optimally functioning. And everybody's a little bit different with the hormone uses, knowing that when you do reduce the use of the bioidentical hormones, the aging, some people will take over faster. So heart disease, diabetes, mental function, Alzheimer's, dementia, bone health, all of that will be compromised as the hormones decrease. Also keeping in mind that the higher the amount of stress we're under, the more we're burning out our hormones. And so people who are under a lot of stress may need more hormone balancing to help them, versus somebody who is 80 years old and is not really going through much stress. They may not need as much hormones, and they may do absolutely well without any hormone therapy. So it's all the things that we consider when we are prescribing some of these hormones. And then there's balancing of the testosterone, and some of these are things that help keep the hormone testosterone in balance. That is really important, and we'll go through it with the next weeks on testosterone, men's health. And then the estrogens, blocking some of that toxic estrogen is very, very important, like we talked about. And these are some of the things that you can incorporate in your diet, some of the things we end up prescribing in order to block some of the toxic estrogen being from forming, but also helping the liver to process some of these estrogens. So I think this is about time. I don't know if there's many last minute questions that you guys may have, but I believe we're pretty much up to 1 hour on this thing. So I talked a lot, and I really appreciate everybody being here and joining me. I'm always honored to be at your service. All the doctors here are very much honored to be at your service. If you are interested in discussing more, we can do telehealth visits or in-person visits now and help you go through the process, your journey of hormone balancing, which is really a journey that is really satisfying and creates this sense of well-being that you feel much more functional and much more useful in the world around you, in your relationships and in the work and the services that you offer to the world around you. So thank you so much for joining me, and I look forward to seeing you next week. We'll be talking about men's health next week on Wednesday at noon. Take care. By the way, Instagram, if you guys are on Instagram tomorrow, we'll be doing some more question and answer with Dr. Marian, and then Facebook Live as well. Talk to you soon. Take care. Bye-bye. Thank you so much.